My name is Matthew, and I am a options trader. We have an options trading company, a proprietary trading company in Chicago. We trade commodities and equity index options. Well, it's a pretty complicated issue, but anytime that the government gets involved and tries to regulate or take over an entire industry, it kind of worries me. Well, I think for the course of our company, the people that have been around the time, and I think that this is probably pretty much true everywhere. It seems that you are getting less and less for more. So people are grateful just to have health insurance and have the opportunity to go to the doctor, but they definitely feel like their dollars aren't stretched as far as they used to. That's for sure. Well, personal choice definitely works. I like to be able to choose the doctors that I go to, choose the treatment, um, choose the what works best for me. What doesn't work, I think that having a lot of people who don't pay for the health care that they receive, um, that doesn't work. The amount of people that don't have health insurance, probably more by choice. That's another thing that doesn't work, but it's kind of symbolic of what's going on in our society anyway. That's a big question, and that's a tough one because it is a big machine. I mean, it's big business, it's big everything. But the one thing that I would change would be that people would be more responsible for their own bills. I get really concerned when people rely on the government for their help or for guidance or for any of that stuff. And I think that it's most important for people to kind of take the choices into their own hands, and there's less and less people doing that, so it's making it harder and harder on everyone else who is trying to pay into the system, cover their own care, and do all the right things. Well, this also, I mean, anything you do with this, it's a complicated issue as well, but just to give you an example, uh, I have a daughter who's 1 year old, who was born a year ago, and if you take all the bills, she was a completely healthy, normal baby, but you take all the bills and everything that was associated with her giving, being born, the hospital, the doctor, et cetera, it was over $30,000. And, we're only in the hospital for 2 days, and um, there's a lot of fees and a lot of costs that go along with that. What is the final bill that the hospital actually receives from our insurance company? I don't know, but I do know that I don't think it cost us $30,000 to have this baby. How many other people's babies were we paying for? Um, and that's a big thing. That's a big thing. I don't really think that the true costs are being distributed to where they should be distributed. And that's something that we definitely have to work on. I think another thing that we have to do is try to make the system a little bit more competitive and less lawsuit friendly. Just here in Illinois alone, the OB/GYNs have to pay over $200,000 a year on average for their insurance. That cost is going to get passed to the consumer. Also, there's the doctors really don't have the job satisfaction that they once had because they are having to do more paperwork, deal with more bureaucracies, spend less time actually treating the patients, doing what they went to school to do. And we need to work on letting the doctors get back to doctoring and worry less about the lawsuits and the paperwork or the fight that they have to go through to get the money that they deserve. Well, my view is that anything that a private company can do versus the government, the private company is obviously going to be more efficient. All you have to do is take a look at the United States Postal Service with a company like FedEx or UPS. If those companies did the same practices that the USPS did, then they would no longer be in business. So I think that the private company should have a greater role, and the government should have a less of a role. Their role of the government should be to protect you, to give you a chance to pursue happiness, and really just the government to keep you safe, make sure you're not getting hurt. As far as them getting involved in taking over the industry, or creating a large bureaucracy, that worries me, because as you can see with Medicare and Medicaid, entitlement programs, pretty much anything they touch, it gets less efficient. There's more chances for fraud, and that's not good for anyone. That's only good for the people that are in power. So I would say let's try to open it up a little bit more, have there be more private competition, and just have the government making sure that nobody's being damaged in the process. Well, I don't know, and I don't think anyone really knows. It's a big problem. I think it's every 7 or 10 seconds one of the baby boomers is turning 65 years old. Um, so, and that's a group that traditionally has not saved as much money as they should. They typically have 80% of their wealth in real estate, and they've got healthcare costs that have far outpaced the rate of inflation, and also the rate of return that they're getting on their investments. So their costs are going up while the amount of dollars that they have is going down, and the program that they thought was going to be there to protect them is not. And probably why is that? That's because of government inefficiency and government, they haven't followed the promise that they followed. So will it be able to support people? I don't know. It's going to be a big issue, and it's something that they've got to tackle, but most of the older adults that I know are making preparations to take things into their own hands, and take care of their own medical care. You can't rely on a promise that may or may not be there, and you really, you have to take things into your own hands. So that would be the prudent thing to do. Whether or not the government's going to be able to support a population that's getting older with less output, I don't know if that's the case.
Thank you.
Sure.